could have imagined it, and I'm so thankful for this, so thank you. This is like the best present ever. I am the co-founder and executive director of National Pain Council. Dr. Thomas Klein and I opened our doors in 2019. We're a volunteer-based group of about 4,000 members. Our focus is on sharing information concerning various treatments for different types of health issues. Our doctors write position papers for the public. We educate patients on how to advocate for themselves. We help patients find doctors who have lost access to treatment due to doctors retiring, resigning, or that no longer feel they're able to treat patients in pain without being at risk of the investigated by the state medical boards and the VA. National Pain Council also helps patient advocates create state legislation to protect both patients and doctors. I have been a part of the teams creating state legislation for Arizona in 2023, Illinois in 2024, and most recently we've been working on legislation for Oregon, which unfortunately didn't pass. So in 2 years, hopefully, we'll have another shot at that. Also a member of the National Campaign to Protect People in Pain. CP3 is an all-volunteer campaign to return the decision-making in pain management to their doctors and patients and remove the politics and law enforcement from doctors' examination rooms. Members of our bureau include medical professionals with decades of clinical experience in pain management, as well as a former national leader for pain risk management and patient education in Kaiser Permanente systems. We have several patient advocates, also with decades of experience and published work. Our work is regularly made known to over 2 million medical industry professionals, doctors, nurses, mental health agents. Our Bureau of members have briefed senior officials at the FDA in July 2024 and the Chief of Staff Director of the National Institute on Drug Abuse in October 24. The project was the real opioid crisis in 3 charts, and in case if you're interested, you could Google it and read it. So I speak on behalf of millions of patients across the United States. We may not have the same exact health issues, but we all had sudden trauma that led to developing health issues, lifelong health issues, and living life in constant pain. What none of us realize is, until it happens to you, we are one accident away from this type of life. Unfortunately, this started for me when I was 16 years old. June 4th, 1994. It was a beautiful sunny afternoon. It was a Friday, and I just got out of softball practice. I was supposed to drive three other teammates home, but they didn't go with me. They went with somebody else. So I started driving home in my 1981 Volkswagen Rabbit convertible, listening to Bob Marley's 3 Little Birds. At the bottom of the big hill, I started at a left-hand turn and was waiting for 3 oncoming cars to pass me. And then, bam. I heard people asking, like, how are we going to get her out? We cut her seatbelt. Then I saw flashes of blue sky, people that looked like they were in the military kind of standing over me. And I heard sounds of a helicopter. All the while, I kept thinking, am I home? Like, am I in a dream? How did I get home? I didn't understand anything. And then there was nothing until there was an immediate, sharp, searing pain, like a lightning bolt, and for a moment, like I was awake. I remember seeing a lot of doctors and nurses standing over me, and I was in a hospital bed, and we were on an elevator, getting off and from the floor divide. And that's what woke me up in a flash of pain. Then there was nothingness again. The next image I had was of a machine over me taking images. And I was out again, and sometime later I woke up in a hospital bed next to my dad holding my hand. And he was crying. And I never saw my dad cry at this point, so it was just like, And he explained to me where I was and what was going on. He said that I was hit in the rear of my vehicle by a pickup truck going 55 miles an hour. My car was flung forward over 50 feet. It did a complete 180, and I landed on the other side of the berm. There was a father and son that was behind the truck that hit me, and they thought I was falling out of the car, so they were looking in the fields for me. Another person that saw the accident happen, they worked for the local EMT, and they noticed I was still in my car hunched over. So he made sure my airway was clear, and he held my neck until paramedics came. I was life flighted to a hospital nearby, where they found my broken C3, C4 vertebrae. I remember looking at my dad, and the both of us were crying. And I told my dad I could have died, and I would have never even known it. It happens that quickly. A week later, I was supposed to try out for the Junior Olympics in field hockey. I was in extremely great shape. My doctor told me it's probably why I was still alive and not paralyzed. I spent 9 days in the ICU unit. The neurosurgeon wanted to put a halo on me to stabilize my neck. Before the surgeon did that, though, my dad spoke with him, and they ended up setting on a 2-post brace that I had to wear for 6 months, and I have to say that was the longest summer I've ever had in my life. I was allowed to walk, but there is little else I could do, and I hated that brace. I had to wear it 24/7, it never came off, and just when it would start to loosen up, I had a doctor appointment, and he would tighten the bolts, so it would start hurting. And it's just my ears and my jaw just constantly hurt. But you know what? I was so thankful I was just alive, and I wasn't paralyzed. So I missed my junior season in field hockey, which is a critical year when you're competing for an athletic scholarship to college, which I was. And sports were everything to me. It's everything revolved around sports. And my theory was that every moment I wasn't practicing, preparing, or playing, there was someone else out there that was doing all these things and that would take my spot. I was a goalie. To stay involved in my junior season, I coached the other goalies in my high school team. That winter, I started training again for the United States field hockey team because I was on the United States team, which I got into in 8th grade. So I did everything I could concerning diet, aerobic exercise, mental preparation, and practicing. And I think that kind of helped prepare me actually to become disabled, actually, because you have to do similar things. So I missed that critical season. I still had over 50 colleges interested in me playing at their school. I was considered the top goalie in the United States for my age. I've been awarded an athletic scholarship to the Ohio State University. Anybody Buckeyes? Go Bucks. College was pretty uneventful. I graduated in pre-law with a major in English, racism, feminism, and journal, and a minor in international politics.